We have seen above the changes seen in the uterus, cervix, vagina, external genitalia, the systemic changes, and some points about the lactation in our previous two videos. So, now continuing with that, next we will see about the care of mother during puerperium. Just to revise, puerperium is the time which is 6 weeks postpartum. So, coming to the care, the patient should be visited daily for 7 to 10 days, and at each visit the vitals of the patient, the lochia, involution of the uterus, the state of perineum and the state of bladder should be checked out. The first thing is early ambulation. The mother should be made to get out the bed at the earliest. So, the early ambulation decreases the frequency of venous thrombosis, this is because when the patient lies down for a prolonged period, there is venous stasis which can lead to venous thrombosis. So, by early ambulation we decrease the frequency of venous thrombosis and pulmonary embolism. The thrombus can dislodge by forming pulmonary embolism. Also, by early ambulation we decrease the complications of bladder like urinary retention, catheterization, and constipation. Next will be the monitoring of after pains. Firstly, what are the after pains? So, after delivery, the uterus starts contracting vigorously to reach its pre-pregnant size. So, the painful vigorous contractions of the uterus are called the after pains, and these are more likely to occur in multipara than in primi who have had a precipitate labor, or in case of primi who has had a over distended uterus. Next would be the monitoring of temperature. Coming to the monitoring of temperature, the temperature should be monitored at 4 hourly intervals, and any rise above 100 degrees Celsius should be specially noted. Generally, just after delivery there will be physiological rigor, which comes back to normal within some time. If the temperature stays high or doesn't come back to normal, then we should report it immediately. There could be any possible infection, either uterine infection or urinary infection. Next will be the advice on diet. The mother should be encouraged to eat and drink something 2 hours after delivery, and the diet of a lactating woman should contain increased protein, meat, fish, fresh fruits and vegetables, so the total dietary requirement is increased by around 600 kilocalories in case of lactation. Then the iron supplements should be continued for at least 100 days post delivery. And we should ensure adequate hydration for the mother. Next will be the regulating bladder and bowel movements. So the early ambulation and early feeding there is decreased incidence of constipation. Next will be the care of the breasts. Important thing is the early identification of retracted nipple. Then we should teach the mother to clean her areola with water after each nursing. The early breastfeeding also decreases the PPH by promoting oxytocin release. So it is advisable to start breastfeeding within half an hour of delivery. This is about the breast. Now the care of the perineum. The perineum, in case of any wounds, should be sutured and kept warm, clean and dry. Then we should cleanse the vulva from anterior to posterior. Sometimes glycerin fermentation is also used for edema and discomfort. Next will be immunization. in D negative women who is not isoimmunized, with a D positive baby, she should be given anti-D antibodies as a prophylaxis in a dose of 300 micrograms. Immunization is given for Rh negative female with Rh positive baby So in that case, she should receive 300 micrograms of anti-D So the next will be recognizing postpartum depression. There will be mild transient depression known as postpartum blues. Which is common in first few days. Then next would be the timing of discharge from hospital. So in a case of uncomplicated delivery, the mother and the baby can be discharged within 48 hours. And she should be advised regarding some changes like lochia, milk secretion, and other significance of warning signs like fever, excessive vaginal bleeding, leg pain and swelling, etc. So this is all about the care of mother during the puerperium. Thank you.